Okay, so a lot of you are anxious for part 2, so here it is. By the way, filmed the whole thing this morning, posted it, gone. Has that ever happened to you? Anyway, number 1, Kegel exercises. Strengthening the pelvic floor muscles is the most important thing to prevent stress urinary incontinence. That leakage when you cough, laugh, sneeze, and those abdominal muscles overcome the muscles of the pelvic floor. I'm gonna do a part 3, I think, to tell you how to correctly do a Kegel exercise. So you've been doing Kegel exercises left and right and it's not working. I usually recommend then going for formal pelvic floor physical therapy. Yes, that's a thing. There are therapists that specifically specialize in strengthening the pelvic floor. They do things like stim and teach you the proper way to contract those muscles, relax those muscles, and perfect your voiding technique. Beyond that, there's a couple of treatments that are not FDA approved, not covered by insurance, but we have and we offer. One is Emsella. It's a chair you sit on. It mimics doing Kegel exercises. It's like doing thousands of Kegels in just 30 minutes. You wear all your clothes, non-invasive, super simple, doesn't hurt. And number 2 is Vtone. Vtone is a probe that's inserted into the canal, and it does the same thing. It contracts those muscles to produce a Kegel exercise for you. Also very successful. Moving on in the treatment algorithm, there's 2 other procedures that we do, bulking agents. We inject a gel-like substance around the urethra via a camera inside the bladder. We can give you some anesthesia if needed. And then the second one is a sling, which is where we put a piece of material underneath the urethra to support it. And this is probably the most efficacious option, however, requires anesthesia, downtime, so it's obviously the most invasive as well. There's some other things on the market that I don't really use very often but are available, like a tampon that you can insert into the vagina that puts support underneath the urethra. It's supposed to help with leakage, and then a pair of shorts that you can wear. I may do another post on this coming soon.